Hello guys, welcome to my new video. You all know that my introduction. So today I want to discuss the topic. The topic is very important, by clinically, by publicly. If we talk about the topic name is diabetes. Today I want to try my best to cover the what is a diabetes, how it is called, what is the symptoms of diabetes, how a common person knows that she or he have a blood sugar level or diabetes. So if we talk about the recent number, so Pakistan is one of the large country which have a mostly diabetic patient by statistically. So today I want to discuss the what is a diabetes. A diabetes is a condition. It's a chronic disorder in which our pancreas does not produce the insulin level. So what is the insulin? Insulin is a hormone which produced by a pancreas. The function of a insulin is to store the blood glucose level. So this is a God gifted by naturally. When a normal human body have a normal insulin level, then when we take any blood glucose level, then this insulin goes and absorb the blood glucose level. That's behind this reason the normal blood glucose level is a normal in a normal human. But if any person which have a abnormal insulin level, his pancreas does not produce the insulin, then what happened? Then his blood glucose level goes and to accumulate. It means that insulin does not work here. So that's why our body develop a blood glucose level, because this blood does not evaluate, does not circulate in our human body. That's why a patient, a man develop a diabetes mellitus or random blood sugar. So how we detect that if any person have a diabetes or random blood sugar? Some common and solid symptoms is the person which have a diabetes are involved in the frequent urination, mean he do a excessive urination. His weight loss, mean a sudden weight drops. He have some UTI infection. This is the other symptoms. And the other solid symptom is that the hunger's increased, mean the patients want to eat more but his weight loss, because insulin does not work properly. So this is the solid symptoms: weight loss, hunger cry, frequent urination. And the other solid symptom is that if he have a wounds, then bones does not heal properly, mean weakness of sore healing. The other symptoms is that. And if we talk how it is happen, what is the management skills? It's happen if the person don't do a exercise, if the person lifestyle is totally different. It's also came by genetically, it's also came by obese person, meat weight increased than normal, and he does not evaluate his clinically laboratory test. So if we talk about the clinically interpretation, we interpretation in this time by two methods. First of all, we do a clinically laboratory test, random blood sugar, which known as the RBS in a short form. So if we talk about the normal range of RBS, the normal range of RBS is 80 to 140 milligram per deciliter. So it means that if a person have this type of range 80 to 140 milligram per deciliter, it means that this patient have a normal random blood sugar. But if we talk about the diabetes patient, his RBS random blood sugar is crossed than 200 milligram per deciliter, 300 milligram per deciliter, so etc. So if we talk about the recently test is very computable, is known as the HbA1c. HbA1c is a stand for hemoglobin A1c. In this test, we evaluate our 3-month previous blood sugar level in our body. So if we talk about the normal range is a start is a 5.7%. So it means that if a person have a 5.7% HbA1c level, it means that the patient is non-diabetic. If the patient increased than 5.7, it means that the patient are in a pre-diabetic or diabetic. So today I talk about the what is the side effect if the patient have a diabetes. The diabetes are known as a silent killer. So it have some infertility problem, kidney problem, UTI infection, sore healing, weight loss, hunger cry, and so other other disorder have developed in a because they have a low immune and weak immune system. So what advice we give to eliminate this solution? We do our exercise regularly. We do a lot of our style body change. We don't take a junk food. We take a healthy food. We take a regular exercise. So if we have a excessive weight, then we lose our weight. So this is the solution. Diabetes have a two type: type 1 diabetes, type 2 diabetes. If we talk about the type 1 diabetes, in type 1 diabetes insulin is a compulsory. If we talk about the type 2 diabetes, insulin is not compulsory. A oral form of tablet given by patient, for example metformin, glucophage, etc, etc. So if you have a diabetes, then you consult your diabetologist and take a proper care, because it is a very dangerous and it is a very shocking disorder, autoimmune disorder in a human body. So take care of your health, because health is a wealth. So do a proper regular exercise and do a lot of things. So I hope you like my video. Thank you so much for your love. Take care.